What if I told you there's one small area on your body that most men completely ignore? An area connected directly to blood flow, nerve activation, and pelvic strength. And stimulating it for just 60 seconds a day could improve circulation in one of the most important regions of your body. No pills, no devices, no invasive treatments, just your hands, and one overlooked anatomical zone. Stay with me, because in this video, I'm going to show you exactly where this area is, why it matters, and how to stimulate it safely, and I promise, by the end of this video, you'll understand your body in a way most men never do. I'm Dr. Elena Hart, and on this channel, we talk about real, evidence-based male sexual health, without myths, embarrassment, or unrealistic promises. Today, we're talking about something surprisingly simple, the perineum, and why this small area plays a much bigger role in male performance than most men realize. Before we talk about the technique, you need to understand something important. Erections are not just about testosterone. They depend on three major systems working together. Nervous system signaling blood vessel dilation, pelvic floor, muscle strength. As men age, these systems don't break. They simply become less efficient. Blood vessels lose flexibility. Nerve sensitivity can decrease. Pelvic muscles weaken, and the result, morning erections become less consistent. Firmness may decline. Response time increases. This isn't failure. It's physiology, and physiology can often be supported. Now here's the part most men don't know. There's a small area between the scrotum and the anus called the perineum. This area sits directly above the pelvic floor muscles, important nerve pathways, blood vessels supplying the penis, and just above the prostate gland. It is essentially a convergent zone, a communication hub. When gently stimulated, this region can increase local blood circulation, activate pelvic floor muscles, stimulate nerve pathways, encourage awareness and control of the pelvic region. Not magic, not mystical, just anatomy. Let's be clear about what this does and what it does not do. It does not instantly cure erectile dysfunction, replace medical treatment, override serious vascular disease, but it can improve local circulation, enhance mind-muscle connection, support pelvic floor strength, increase body awareness, and when combined with lifestyle changes, the effect can be meaningful. Now let's talk about finding it. Sit comfortably. You can be seated upright or lying on your back with knees bent. Take your index and middle finger. Place them gently in the soft area between the base of the scrotum and the anus. You'll feel a slightly firm, cushion-like area under the skin. That's the perineum. If you've never paid attention to this area before, it may feel unfamiliar. That's normal. Here's the exact method. Step 1. Get relaxed. Your body should not be tense. Step 2. Apply firm but comfortable pressure. Not painful, not aggressive, just steady pressure. Step 3. Begin small circular motions, clockwise for 30 seconds. Step 4. Switch direction, counterclockwise for 30 seconds. Step 5. Breathe deeply. Slow inhale through the nose for 4 seconds. Slow exhale for 6 seconds. This breathing enhances parasympathetic activation, which supports erection physiology. Total time, 60 seconds. That's it. Here's something most people overlook. Erections are parasympathetic driven. That means they happen when your nervous system is relaxed. Stress shuts down blood flow. Deep breathing increases vagal tone and improves vascular relaxation. So this isn't just massage, it's neurology. Twice daily is ideal. Morning, before bed, optional. 15-20 minutes before intimacy. Consistency matters more than intensity. Overdoing it can cause irritation. Days 1-3, you may feel warmth or mild tingling. Week 1, improved awareness of pelvic muscles. Weeks 2-3, better muscle control, possible stronger morning responses. Week 4, improved consistency and confidence, but remember, results vary. If underlying vascular disease exists, medical care is essential. This technique works best when combined with daily walking 20-30 minutes, proper hydration, pelvic floor exercises, Kegels, blood pressure control, sleep optimization. Because erection quality is a cardiovascular marker, improve circulation system-wide. Results improve locally. After your 60-second massage, Do 10 pelvic floor contractions. Contract as if stopping urination. Hold 3 seconds. Release completely. Repeat 10 times. This strengthens the muscle group that maintains firmness. Do not perform if you have acute prostatitis, severe pain in the area, open wounds, active infection. If you have known prostate disease, consult your physician first. This is supportive care, not a replacement for medical treatment. Gentlemen, erectile changes are often early cardiovascular signals. Instead of ignoring them or masking them, use them as information. Your body communicates through circulation. Support it. Strengthen it. Understand it. 30-day challenge retention plus chest engagement. Here's what I want you to do. Commit to 60 seconds, twice daily, for 30 days. Track morning response, pelvic awareness, confidence level, then come back and comment. Because your experience may help another man realize he's not alone. If this video helped you understand your body differently, like the video, subscribe to Dr. Elena Hart, Sexual Health and Wellness, share it with someone who needs evidence-based guidance. Next video, we're going deeper into circulation science and nitric oxide and why blood flow is the true foundation of male performance. Until then, take care of your circulation, take care of your strength, and take care of your health. Here's the exact method. Step 1, get relaxed. Your body should not be tense. Step 2, apply firm but comfortable pressure, not painful, not aggressive, just steady pressure. Step 3, begin small circular motions, clockwise for 30 seconds. Step 4, switch direction, counterclockwise for 30 seconds. Step 5, breathe deeply, slow inhale through the nose for 4 seconds, slow exhale for 6 seconds. This breathing enhances parasympathetic activation, which supports erection physiology. Total time, 60 seconds. That's it.